pump. It's wonderful. I can remember working when I was out as a new graduate working in neuro and orthopedics. We had very few pumps. They were coveted. And so you felt like that person in the circus or on a vaudeville show that you've seen doing this with the plates and trying to keep all the plates up in the air. That's how it felt, trying to keep all the IVs not running dry because we only had a few pumps, but we had lots of people on IVs. So it's a great thing. And these pumps are awesome because they have guardrails built into them. And when I finished and we went through all this stuff, the student goes, guardrails, I get it. It protects us. Yes. And so you always want to use the guardrails on the pump. There is a thing called basic infusion on the pump. There's 3 choices. And this is also for your checkoff sheet that you'll see this. One of the questions is, what are the first 3 things that pop up? And it's guardrails fluids, guardrails drugs, and basic infusion. Stay away from the basic infusion. The only case that you would want to use that is if maybe you're on an oncology floor and there's a new drug that they're trialing, and you're going to have to put all that information in manually. You would use basic infusion. That being said, if I have to use basic infusion, I want 4,432,000 people looking over my shoulder and validating that everything I'm doing is correct, because you have no guardrails to protect you. Whereas with the other things, you will have the guardrails to protect you. So the pumps, they can have up to 8 channels. 8 channels on one patient. And how it goes, you read it from left to right. So it'll be A, B, C, D, E, F, G, H. And I have seen a pump with 8 channels connected on. And sometimes what you'll see, these things will be telling you what the rate is and what it is, but you know, it's spewing out a lot of stuff. So sometimes you'll see nurses will put just a label here, dopamine, insulin, whatever's dripping, so that just at a very quick glance they know what it is. Okay? All right. So you know A, B, C, D, E, F, G, H. How this comes off is you push on this little dude here. Oh, come on, Jan. I have to turn it, sorry. So push in on this, lift it off. See how this kind of snaps in? Okay, listen for it. If you don't snap it in that hard and you call biomedical that your pump isn't working and they just come up and go, they're going to be furious. So always make sure that you really get that snapped in, okay? All right, so how do we turn this thing on? There's 2 things. You got to know how to turn it on and how to turn it off. So to turn it on, you're going to go to this main body here, and you're going to hit System On. And red, green lights. Okay, it's coming up. See, it's coming up. It takes a few minutes. Okay, all right, so here it starts. It guides us to make sure we're doing everything correctly. So it says new patient. Yeah, it's a new patient. Adult, yes. And now it says there's a light A here because we don't have any other things here, but it's only light. So it means that we haven't communicated these 2 to each other. So if you have 2 things on here, what it'll say is down in here, it'll say channel select. So are you going to choose channel A or channel B? So if you just have 2, you may have 1 here and 1 there, however you set it up, but know that it always will go left to right, okay? So we're going to say channel A. So now, select channel. We want this one, so we'll hit select channel. Now look, A, channel A's infusion menu, and see the choices come up. All right. If you want to shut it down, you will channel off. How we turn the pump off is channel off. Yeah, you're squeaking. Press and hold. So I'm pressing and holding. Come on. We're wanting to shut down. Powering down, okay? So that's how that happens. All right, so we're gonna let this be for just a few minutes. So now we're gonna talk about fluids. So when you go to hang an IV, start hanging fluids, maybe somebody already put in a IV in someone for in the ED, knowing that we might have to give fluids. So they may have just put one in with a little heparin lock or saline lock, and there it is, okay? So yeah, this is so there it is, and we got our little, we'll have a little cap on that. So the first thing you'll want to do is, after you check the MAR to see that you have this order and you've gathered your supplies, you'll want to make sure that your IV is patent, that it's working. So what you'll do is take your cap, clean this off, you'll screw your syringe on, and this should have a clave on it, and it doesn't. So this actually goes on to the IV, and this doesn't have a clave, but we'll put this on here. So this is screwed onto our IV in here, and we'll take this and we'll flush and pull back to make sure it's patent. And once we know that, we can take this off, because it will have a little thing there that we can do, or you can leave it on if you want. But we know our IV is patent, and we're good to go. So then what we're going to do is we're going to wash our hands, and we're going to tell the patient what we're doing, and do our IWIN, check the identifiers. And now we're going to take our fluid out of the bag that it's come in, and we'll rip the bag, and we're going to look, is the bag wet? If it's wet, we don't want it. What's the expiration date? Okay, but we see that it's not wet, it's nice and dry, and we'll use it. Fluids come, this is the biggest they come, 1,000 milliliters. And then there's 500, 250, 200, 150. So they can go from very, very big to very small. Usually these great big bags we use on our surgical patients, because when they come in, they're dry, they're NPO. So we're gonna start pushing fluids. In the OR, they'll push fluids. And then afterwards, we may even push more fluids to get them all caught up. So we know that this bag is good. We got our Alaris primary tubing. And what makes it primary tubing is this little guy here. This little guy right here. So we're gonna take our tubing out, and we're gonna keep it above our waist, and we're going to clamp it off. And you can clamp it off two places. You can clamp it off here, and you can also clamp it off to the pump. That goes into the pump, but I don't like to do that. I like to just clamp it off here. It's below the pump, and it'll work well for me. And this way I have it open. So I'm gonna hang my bag up, but not here. Here I would get a bath. But in real life, when you're at clinical, trust me, you can hang your bag up here and pull the nipple off, and you're not gonna get a bath. But here, if I pull that off, I'm gonna get a bath. So I'm not doing that. So we'll take this off, and again, you wanna be sterile, right? So we're gonna pull this off, and then we're gonna take and pull the cover off of it, go straight in. If you go sideways, you can put a hole in this, and it's gonna leak all over the place. Be careful, it's sharp, it could hurt you. So be mindful of that. And then I'm gonna take my bag, and I'm gonna hang it up. I'm gonna grab my tubing, and I'm gonna squeeze my chamber. This is the only time you need to squeeze a chamber, is when you hang a primary for the first time. So do that. And I like it to be about 2/3 of the way full, so you can see your drips. And then I'm going to slowly come down here. But before I do that, I want to show you. Okay, this piece goes into our pump, and this is the top of the piece that goes in the pump over here. So above our pump, we have a line, a port. This is usually used for IV piggyback medications like antibiotics, okay? Then below the pump, we have our roller clamp that can control our drip, and also we have one more port where we can do things. And if you think about it, This is going in close to our patient. So why do you think we would have this one?
For faster administration.
So
When you inject medication.
exactly, you're both right. Medications we want to get in quickly, right? Like pain medicine that we get IV push. So this is our access point for that, and so I want you to be aware that we have that. Okie dokie. Now then, I'm going to, and we're violating sterile technique here because our bucket is way down here. But in real life, you would not do this. Okay, you would have it over the sink. So I'm very slowly. I've got to get rid of the air. I've got to flush all the air out of this line. And here it comes. Looks good. So I got it primed. Now then, you could go ahead and connect this to your IV here and shove it in there. Oops. And you could be good to go, okay? But before I would turn this on and start my drip, I'm going to go back to my MAR and make sure it's the right fluids, it's the right patient, and everything is right. Because once you open this up, it's in. You can't go back and go, it's done. So you always want to make sure. So I tell students, never hesitate to check, because better to check than not and get in serious trouble. So from this point here, you could actually run this bag. And back in the day when we didn't have pumps, that's exactly what we did. We just would regulate with this clamp. So you can do that. But we have the pumps, so we'll put it on the pump, okay? So how we do that is we open this up and we put the little hat so it sits there. See how it's sitting? And then we're gonna make sure this is unclamped. So you can see it's unclamped. You can also push on this and clamp it, but I don't like to do that. That's clamped, okay? So we're gonna unclamp it. It always makes me scared. And then we're gonna shove it in there, okay? And then there's one more little channel here. See that little channel? You wanna push your tubing in there really good, and you don't wanna drop your tubing on the floor and contaminate it. Okay, so now we're going to, how do I turn my pump on?
The system on.
Correct, okay. And there it is, okay? While this is warming up, I want you to be aware of this on your tubing. If you pop this open, it aerates. We don't need it for our bags, our plastic bags. But if you hang a bottle like albumin, and then I think it's IGIF, I think is what it is. It's another thing that comes in a bottle. You must vent it or it will not flow, okay? Bottles, you gotta vent. Bags, you don't. Yes. Okay, so new patient, yes. Adult, yes. Okay, now I'm gonna come over here and choose my channel. And I'm gonna say guardrail fluids. And I'm gonna say maintenance. But you can see there's a wide range. So look, you can hit that. If we hit B, look what comes up for B. Whole blood. So whole blood can be hung as a primary fluid, okay? And let's page down. Here, okay. So you can go to like platelets, packed red blood cells, if you need to, and that'll be under P, okay? All right, so I want to go back. I'm going to go way back. Okay, choose my channel, guardrails, fluids. I'm just going to choose IV maintenance. Is that correct? Yes. Okay, my rate. Since it's maintenance, I'm going to say 75, okay? So press rate, look how it gets black. So it's telling me this is what you want to choose. 75, and then I'm going to hit enter. Look, VTBI, volume to be infused is what that stands for. So we've got a 1,000 milliliter bag. I like to underestimate, so I'm going to say 950. So that at 950, the little alarms are going to go off, and I still got 50, so my bag doesn't run dry. You may feel comfortable in putting 1,000 mil in. That's fine, that's your choice. This is a choice that you can make as to how you want to do it. Maybe you prefer 900 as opposed to 950. So I'm going to put 950. And notice secondaries coming up as I'm doing this. So if I hit this button for secondary, it's going to let me put in the secondary, but I don't want to do that right now. So we're just going to say start. And so look what it says. It's checking the lines, and it's going to start screaming in just a minute. And watch what it says. What's it saying?
Included.
Patient side. So if it's talking about patient side, it's anything on the tubing from right underneath where it comes out of the pump to where it is in the patient. So if we open this up and we hit restart, we have the green light, all is well. Now it's going to flow, and it says 75 IVF maintenance. IVF maintenance, so all is well. So the last thing I want to do, or somewhere in this part where you hang a primary solution, you must label the tubing, not the bag. The bag will be accounted in the MAR as the drug, but it's the tubing that we must label. Because tubing can be very expensive, we may use this, like we may hang 8 bags of lactate ringers because of our surgical patient. So we're going to keep changing it out in a 24-hour period. So we don't need to keep changing the tubing out. It's the same fluid, no issues. But it's important for us to know how long was this tubing up. So you label the tubing one time when this tubing was first hung. You won't change that labeling every time you put a bag up, because if you do, we lose track of how long this tubing's been up, okay? So make sure you label it, make sure you check your record, and then the documentation is the fluids went up, IVs paid, the fluids went up, patient tolerated well, blah, blah, blah.
How long can a tube stay up? Is there like a...
There's a hospital protocol. So each one has their own different way of saying. So you'll have to be aware of what your hospital protocol is. But yes, it will stay up for a while. So now we've got this all going. I want to show you one more thing. In the back here, and I'll turn around in just a second, but I want you to see, there is a black button. I'm hanging on to it for about 3 seconds. Watch the screen. What's it say?
It's locked.
Panel locked. It'll say that and it'll go away. So this is a great thing. If you've got somebody who likes to play with their IV rate or their IV drip or whatever, discreetly, so you have to turn the pump so they can't see that message come up on the screen. Reach back here and hold on to that button, and I'll show you in just a second. For about 3 seconds, and it'll say panel locked. And as soon as it says that, you know it's set, they can't mess with it. Likewise, when you go to turn it off, when you're done with it, you must come back here and reach. Now watch what shows up.
Yeah. Okay.
Panel unlocked. It has to be unlocked in order to shut it down, okay? Now turn it around so you can see. Here's the mystery button, okay? Any questions about hanging a primary Alaris pump fluid? Didn't confuse you? Pretty straightforward? Okay, so now we get an order. Our unit manager says the doctor just got a new order that we have to hang an antibiotic, okay? We've got a sick person. Their white count came back and it's 11,000, so we're going to hang an antibiotic. So same thing, you're going to get secondary tubing. And notice it's very simple. There isn't a whole lot to it. Very, very simple. And the bag, again, we'll take it out, we'll examine it. Is it really what we want? We're gonna check it with a more, yes, this lines up, all is well. Then we can hang it up if you want, or again, you can take your thing out there. Now watch, this is one of the different things that we do when we're doing a secondary. You'll look at it, okay, this is good, and you're gonna clamp it off. Okay, this is good, yay. And we're gonna, again, take this off, straight out, and we're going to stab it straight in. And I'm just gonna flip it up, and I'm gonna hang it up. And now what I'm going to do is I'm going to scrub the hub here for 30 seconds, and then I'm going to push this and screw it on. And then, oh my gosh, Dr. Huster, are you crazy? You've got all this air. What are you going to do? You're a crazy woman. Nay, nay. Oh, I still have my sanity. So what I'm going to do is I'm going to take this and hold it down low. Whatever we want to infuse or be in charge has to be at the highest level. And that's where these little dudes come in place. So if you want this running, it has to be high. If we want our IV antibiotic to be running, it has to be higher than this primary. But for the moment, we want this to drive the bus, because what we're going to do is we are going to prime this tubing. We don't have to squeeze on the chamber. How lovely is that? All we have to do is open up this line. So I'm going to open up the line and watch what happens. See how it's coming through? How cool is that? And all I have to do is work the chamber. Okay, that's as full as I want it. Okay, yay. So I'm going to hang it up high. I'm going to hang this down low.
But you have to do that below it, right?
Yes, you have to do that because this is driving the bus. This is what is filling and flushing, okay? So again, I'll check my orders. Is this really what I want? Is this really what I want? And then I'm going to go back and I'll hit my channel select, and you can see secondary pops up here. So I'm going to hit secondary. Now look, you can go wide range of whatever you're hanging. Let's do vancomycin. It's a good one. So I'm going to hit U through Z, and there it is, Vanco. So now I'm going to press along, and I want gram dosing. And check this out. We have 1, 2, 3, 4, and this is one of the questions on your worksheet. 5, 6, 7, 8. And page down. 9, 10, 11, 12. There's 12 varieties of Vanco. And so, yeah. So we're going to go back up, page up. I like 1 gram and 250. So that's what I'm going to choose. Okay? So I'll hit 1 gram and 250. Is this what I want? Yes, this is what I want. So it tells you 1 gram of the antibiotic and 250 diluent. The concentration, look how dilute that is. How it dilutes out that Vanco. Vanco can be very corrosive, if you will. It's not maybe the best, but very irritating to the veins. So that's why you want it diluted out like that, so it doesn't do damage. So I say yes, and watch this when you're setting up antibiotics. Look, I think it's great fun to see how dilute some of these things are. Oh, nuts. Okay, so now I gotta go back because it stopped on me. I took too long. Secondary. So we'll go back. No. See, I want Vanco, and I want gram dosing, and I want 1 gram and 250. Is this what I want? Yes. Okay. Then it says select next. So I'm hitting next. And look, the little bag up there. So we know we're talking about our secondary. And look, it says it's going to take a whole hour for it to go in. So how great is that? It tells us everything we need need to know.
Awesome.
And we
That's the
hit
math
start.
for us.
Okay. Okay. And it's saying 250, 1 gram vancomycin, secondary. So it tells you everything that's going on, okay? And we've got a green light, so good, everything is wonderful. Okay, I'm waiting, it's gonna start screening in just a second. Or it should. Come on.
And then once that's there, you're gonna open this and let it fill out.
Checking the line.
Okay. Oh, forgot to put my name. Date.
Uh-oh,
Name, date.
what's it saying?
It's included.
Occluded. Patient side. So patient side is below. And we'll open this up.
Okay, so then
And then we're going
I go to the
to,
secondary.
now it's green, so everything is wonderful. But if we occlude it, now watch. I got it occluded. Now what is it saying? Fluid side. So if it says occluded fluid side, you know it's something above this, okay? Right? So hit restart, and now it should be fine because everything's open.
For 100. This is correct.
And we got the green light. So when we have a green light, we know everything is fine and all's well. And again, before I would let this infuse, I would double check, is this the right medication, the right patient, blah, blah, blah. And then again, label this tubing, okay? So we've got a really sick patient, and we just got our unit clerk to yell at us, we got another order. White count's going up, it's gone up from 11 to 18,000, so we've got a problem. So we're gonna take this,
Okay, then I have to.
and this is what I want, this is why I want you to have an empty IV bag, because I think it's better for you visually to realize, okay, we ran our fluid in, it's empty, okay? As opposed to still having a halfway full bag, because you're kind of like, is it full, is it empty, what? So, it is empty. And so now what we're going to do is we're going to look, oh, we can still use this tubing. And, oh, it's compatible with this fluid. So now what we're gonna do is we're gonna take this up high, and we're gonna take our empty bag down, and we're going to flush this line so that we don't have any of this antibiotic in here, okay? So how we do that is we open up, and look at it. It's running like a river. Look how fast it filled that chamber. So then I clamp it, turn it upside down. Get out of there, all you nasty things that are hanging in there that might cause problems. Okay, now we'll take it and we'll open it up again. And watch how fast it fills. It just fills up so fast. So rinsing, rinsing, rinsing. See how it's pulling from our primary. Okay, you nasty things. Here we go. Clamp, squeeze it out. Ugh, get out of here, get out of here. Ugh. Okay, one more time, so you do that 3 times. And in doing that, you should have all of this flushed out with this. And anything that was lingering behind from this is now in here, ready to throw away. So we'll turn this off. Flush, flush, flush. Yuck, yuck. Take it out. Sling it in the proper place. And then we'll check our order again. Is this what we want? Is this right? Pluck this out. Stab it. Go in straight. And see, I've got quite a bit there. I might give it one little squeeze maybe 2 squeeze. And then I hang it up high. I take this and hang it down low. Find the drug that I want. Go to secondary. Program what I want, and we're off the races.
You don't have to do anything to that line this time? Because you just did it?
Yeah, so new antibiotic, I will go back in here and I will go to channel A and I will hit, well, it didn't finish it out, so ideally it would. And then I can go to restart. Let's just say restart. And let's say we're going to do a setup. And we don't want the primary. So then we want to get out of here. So the best thing to do is usually just channel off. So it all goes away. And then we'll just start it up again.
So then you would just go in, type the new med, and then hit.
And then we can put in our new antibiotic. Hit select. Okay? Yeah. Any questions? Okay, they're wonderful, they're truly wonderful. So we've gone through everything with the IV tubing, and we've gone through all the stuff with the pump. So you can play with it and practice with it, and I will tell you that, and you'll get this when we go to hanging blood, you cannot hang blood. You have to first hang normal saline and flush the line. It's a Y spoke, and you'll have to flush the line first all the way through with normal saline. You cannot put that in as a primary, because then you have secondary is your only choice, and blood does not show up in secondary in drugs. It only shows up in fluids. So what you end up doing is you'll adjust this and regulate it with this. You could put it on the pump, but you'll have to cancel everything out when you go to hang the blood, because you'll have to go in and make the blood the primary. So one of the easier things is just to go ahead and set it up and regulate it with your clamp here. Then when you get your blood, you hit primary. And then you'll put it in. You'll find the B for whole blood, or a P for platelets or packed red blood cells, and then go ahead and set it all up and run it. So that's one of the things that we discovered. Faculty had to play with it for a little bit, because I'm used to recovery room where it's an emergent situation. Usually if we have to hang blood, we got to get it in there fast. And Professor Malley, working on OB, same thing. It's a hemorrhage. We're racing that blood in. So it's not like we have the convenience of somebody who's chronically anemic and we're giving them blood. So we had to come play with it, and those were things that we discovered. Anything else? So we will tell you when you go to hang your fluid, your primary, what rate we want it set at, okay? Then when you go to hang a secondary, we'll tell you what rate we want that at, okay? And what the drug is. And by doing those things, and then we'll have you switch out to a secondary, like we did. Remember we back flushed 3 times? We'll have you do that. But in doing all of that, you have touched on everything that we ask of you, the pump as well as the tubing. Does that make sense? Okay. Doesn't it feel great to get into this stuff?
Yeah, I'm actually really excited about this.
Yeah. And you can always ask your nurses at the hospital. There's probably some things that they know about this that we don't. And just be honest. We're not over there doing what they're doing. So there may be something that you learn. Feel free to come share it with me. Tell me, hey, did you know they're doing this? One of the students is at hospice, and evidently there's some kind of sub-Q catheter for fluids or something that they're using, and she says they put it right here, and it's really cool, she said. And so she was going to see if she could get one of those for us, because I hadn't heard of that. That was something new. But for hospice patients, trying to find a vein is really not a good thing, is it? No. So yeah. And we won't touch upon it here. We'll touch upon it when we're starting IVs, that you got to be sure that the IV catheter size is appropriate for the fluid you're making, because blood will not go through a 22 gauge catheter. It's not good. Sometimes the hospitals are using